What I want to do is make people aware. So, as you can see, they're swollen. I have not had filler probably in over a year, but whenever I get sick, my immune system basically goes to the filler. This happens like every time like I'm really sick, and I ended up getting sick yesterday, like when I run a fever or have like body aches, not just like your typical, little allergies. It doesn't do it on that. Basically, I'll just take Benadryl or ibuprofen. But I mean, yeah, they're pretty swollen.
This provider with a history of lip filler is experiencing swelling when she gets sick. Why does this happen? She said it's likely when she has a fever or kind of a moderate illness, not with just allergies. Why is this happening? Is the lip filler causing it? I want to dive in, but before I dive in, I do want to share that this is rare. This isn't something that most patients with lip filler have to worry about on a daily basis. In my entire career, I've seen one patient that has experienced this. So I do want to start off by saying I'm not trying to put fear in anybody and run away from lip filler. I think lip filler is such a beautiful treatment. It is rare, but you should be educated if it were to happen to you, why this is happening. So let's dive in. So, on rare occasions, this can happen. Where it's documented the most is when a patient gets sick with an illness like a virus, or when they've had prolonged exposure to heat, meaning a weekend on the beach. So, let's start off with why this happens when somebody's sick. When you're sick, whether it be a flu or a viral illness or just a significant cold, your body, your immune system releases these chemical messengers to fight the infection. And these signals increase blood flow, they loosen the blood vessel walls, making them more leaky, and it allows fluid to shift out of the bloodstream. Now, this process is normal and protective. But one side effect is that fluid can shift more easily into those soft tissues. So, why the lips? The lips are a highly vascular area. They are made of thin and loosely structured tissue. They are poor at draining fluid, and they're also made of semi-mucosal tissue. So, when blood vessels get leakier, they take the path of least resistance, and that path is often the lips. So, this is why the lips are a common site of swelling in situations like angioedema or allergies. And these are with people that may not even have a history with lip filler. So, we're going to dive in a little deeper as to why lip filler makes it more pronounced. But let's talk about why being exposed to prolonged heat can trigger this similar reaction. When you expose yourself to a prolonged weekend at the beach with heavy sun exposure, your body tries to cool itself down, and it does so by dilating the blood vessels, increasing the blood flow to the skin, and allowing heat to escape. This process also increases how much fluid can move into the surrounding tissues even without an illness. And with the lips, they are superficial, they're exposed to that heat, and they're highly vascular, so they're the ones that are going to swell the fastest. So, why do we see this happen more so with our lip filler patients? Hyaluronic acid itself isn't the cause of the swelling. It's not activating the immune system. It doesn't mean that something's wrong or that your body's rejecting the filler. Hyaluronic acid itself can hold onto fluid that was going to show up because of this environment regardless. Hyaluronic acid fillers are hydrophilic, meaning they love water and they hold onto water. So this reaction is not from the hyaluronic acid filler. It's temporary, it's physiologic, and it's driven by the body, not the filler. Now, some hyaluronic acid fillers are more known to be more hydrophilic than others. Doesn't mean that they're bad or unsafe. It just, that's what their technology is known for. A technology like Hyalocross, which is Juvederm Ultra Ultra Plus, has a tendency to draw in a little bit more water. It doesn't mean that it's an unsafe product, but you have to know that when you're using that product, and an experienced injector knows how to utilize these different products in different areas, right? So I want to reiterate that it isn't a common reaction that lip filler patients experience, but if it were to happen to your patient or if it were to happen to you, now we understand the kind of the physiologic pathway of what is happening. But again, I've had this happen with one patient of mine in my entire career, so I don't want any patients or providers to lose sleep over it, but this did happen to my patient. She had a long weekend at the beach and DM'd me, and her lips were huge. Now, full transparency, she's had years and years of lip filler prior to me coming to me as a new patient. So we don't know which type of filler triggered it, but she had a lot of heat exposure. I put her on a Medrol dose pack and she was fine. She cleared up in 48 hours, probably even less. And she's had lip filler since then. So it's just something to be educated on. It's something to be well informed on so that if it does happen to your patient, you can help them navigate. Or if it does happen to you as the patient, you understand what's going on. It is temporary. So I hope this helps kind of clear it up why this could be happening. If you guys have any topics that you want me to discuss or kind of dive into, I am an open book. I don't gatekeep anything. And if I don't know something, I'll do some digging and some research so that I can learn it best to share with you guys. So click that subscribe button and follow along.